now we will look at a presentation of EURIPA, which is the European Rural and Isolated Practitioners Association. And we will talk about the digital needs and preparedness of GPs in rural areas. And afterwards, Dr. Jean-Pierre Jacquet will be available for questions. So I will share the screen. Can you see this now?
Yes.
EURIPA is a network of Wonka Europe. So, what does personalized medicine mean for rural doctors in terms of digital need and preparedness? Since Hippocrates, it is acknowledged that care and cure are patient-centered. The definition of general practice in 2011 by Wonka insists on personalized care. So, to answer to your question, we ask our member and we choose to present 3 points of view from Italy, Ukraine, and Wales. EURIPA.
Hi, my name is Ferdinando Petrazzoli, and I am the chair of EURIPA Scientific Board. Let me now introduce Dr. Rosario Falanga, the Italian member of the EURIPA International Advisory Board.
In Italy, personalized medicine based on DNA analysis to predict the risk to disease is not foreseen among the essential levels of assistance paid by the National Health Service, and therefore is not implemented. Only some genetic conditions are investigated on the basis of an important genetic-based cancer history, BRCA test or test for some coagulation defects. The personalized medicine is an initiative medicine to allow primary prevention through lifestyle modification to reduce risk factors. The weaknesses are the growing demand, the costs, even if these would be amortized in future thanks to prevention.
Hello, I'm Donata Kurpas, and I have a great pleasure to welcome you on behalf of the International Advisory Board of EURIPA, which brings together representatives of almost 30 countries from all over Europe. And we wish you a successful meeting. Professor Victoria Tkachenko represents Ukraine in EURIPA IAB and will share her national insights with you. Good luck, Victoria.
Dear colleagues, personalized medicine is a basic principle of family medicine that has been implemented in Ukraine since 1987. In my rural places, it is based now on new patient-oriented approach mentioned in international clinical guidelines that take into account a lot of characteristics connected with genomics such as race, hereditary, gender, and other factors of preventive measures and management of diseases. Additionally, e-health system, electronic patient records, international classification of primary care have been implemented since 2018 for help to collect and analyze information about risk factors, encounters, and all data patients to enhance personalized approach. From my perspective, the strength of genome-oriented medicine is that we can identify individual risks and find the most effective intervention for each patient to build more healthy population. The weakness is that genome sequencing may be overused, disrupt natural selection, lead to overpopulation, new disease appearance, excessive interventions in genome of healthy people. Thank you.
Jane Randall-Smith, the Executive Secretary of EURIPA, and I live in rural Mid Wales. Rural areas are often underfunded and resources more limited than in urban areas. This is partly due to lack of economies of scale. Concerns about personalised medicine are the growing demand, limited resources and the cost, even if these would be ameliorated in the future due to more focused prevention. If personalised medicine is the way forward, equitable resources need to be provided across a country and a region. For example, in rural Mid Wales, there appeared to be a low take-up of genetic testing services. It was thought that rural people were not interested in genetic testing and the associated counselling. It turned out that the distance involved in accessing services were putting people off, as they were in a distant specialised centre in South Wales, but people were willing to access closer services in England. A distributed service by the Specialist Centre in Personalised Medicine is a possible way forward, taking services close to the patient. For example, in Birmingham, the testing service is taken out to a number of smaller hospitals in the region to avoid the more remote patients having a long journey to the centre.
Rural GPs are aware of the risk factors linked to the environment and way of life of their patient. Some genetic factors are known for as thalassemia or hip dysplasia in particular region. Personalized medicine is taking the concept further and is welcome. Nowadays, rural citizens must have access to predictive medicine to allow primary prevention through lifestyle modification, precise or personalized medicine for specific drug. There is potential for stigma, loss of anonymity, confidentiality when personalized medicine is used. Ethic board will need to address this to prevent misuse of personalized and predictive medicine. This misuse could be disastrous for rural harmony and individual health.
Thanks a lot for this interesting presentation and these useful examples. And sorry for the technical problem. Jean-Pierre, may I ask you, for your point of view, what can do the regional government to support the GPs in remote, rural and sparsely populated regions?
I think probably the first one could be the education for GPs and rural health worker and social workers. Education, that means CME CPD program to access to better know the possibility of preventive, predictive, and personalized medicine. I think it's the first one. The second one, of course, is not linked directly with GPs, but with the huge broadband access to the rural place. And as you mentioned, we made a study in most European rural country, and it's very, very different position. It depends of each country. And for instance, in France, we have right now optical fiber plan who serve all the rural place. And even if the citizen or the patient haven't a direct optical fiber, it's important to have in the village this access, and we are able to have telemedicine consultation, for instance. This is one point.
Yeah. Are there other things? Do you think the regional authorities should also educate the population of these remote regions? Because you were talking about education of the GPs.
Yes, of course, we have also to educate the patient and the citizen. Probably we have to consider to combine predictive medicine and social prescribing. I think it's something important because patient mustn't be considered as some isolated patient because he is living in his environment, and I think it's important to consider all of this. And we can probably be more proactive for the lifestyle change in the community, not only for a patient, but for the group of patients.
and it should be interesting. But we have to be aware of the risk of stigmatizing the patient and the group of patients. That's why it's something very difficult, and ethic rules and also planetary health is important to consider in our rural region.
And would you be thinking of having your organization also working on the ethics?
We can have all the subject which interest the rural place, and so we can work, of course, in ethics. And probably we conduct a survey. It will be published probably next year, but during the COVID pandemic, we start a study about the use of telemedicine. And it's quite interesting how the patient and GPs adopt this new way of communication regarding telemedicine. But we know there is some risk for a misuse and overuse of this kind of tool. Telemedicine is only a tool; it's not a consultation, and we have to be aware of this. And for instance, in France, in 2016, we had a very precise guideline how to conduct a telemedicine consultation, and all is gone with the pandemic, and we have to be very aware because the risk is important.
The risk on privacy, you mean?
The risk is for the misuse, for false diagnosis, for overdiagnosis, or none. Because if you know that your patient, it's okay, but we saw that some kind of development with it's only a contact between a patient and a GP, but the GP doesn't know the patient and the habit of the patient, and it's a very high risk situation. Very high risk situation. We have to be aware of this.
Yeah. So, and which innovations or what kind of innovations do you think are useful to the GPs of the remote, rural and sparsely populated regions?
I think we have to work with the new tools available with the patient, and the patient connected, the house connected is something important. And we can work with these new tools, but we have to be aware of the education of the patient, education of the GP, education of the health workers. And I remember 2 or 3 years ago, I worked on a project about my little spa. It was a project for a kind of a new tool able to give advice to the patient, personalized advice to the patient. For instance, the patient with diabetes, it's important to give some advice, but personalized advice. You can't tell him you mustn't eat sugar, fat, and so and so. You have to combine with his way of life and its desire.
Yeah, knowing the person, what he is able to do or wanting to do or willing to do.
Yes, personalized and holistic approach, because you can't have a good relation with the patient and to be confident with him if you haven't this kind of approach.
Do you think also the regional authorities have to make some plan to have enough GPs next to the education of them and the broadband access plans, also plan to maintaining enough GPs in these regions?
It's difficult to answer because each European country has its own organization or national health system are quite different. And we can compare, for instance, France and Italy, because in Italy you are not free to settle in where you want. In France, it's possible. And so it's difficult to consider this kind of probably it should be interesting to have a statement or to advocate for a better harmonization in European country, mainly in rural place. And of course, we have a lack of GP in some region, but we have also to consider the advantage, because mainly in the rural in the country, rural is considered as a bad position for a GP or a rural F. But to be in reality, it's a very good position because it's a very interesting, more interesting work in a rural place than in some urban place. The problem is with the partner, is with the children, it's with the school, it's with everything is well known at the moment.
All the services.
And
all the accessible services.
Yes, and the best point to recruit or to retain GPs is when GPs are coming from rural place, they are very keen to settle in rural place.
So thanks a lot, Jean-Pierre, for your insights. And now I give the word to Jolien. Thanks a lot.
Bye-bye.
Thank you. Yeah, thank you.